If you're wanting to be serious about your role as a dentist, there is no more serious help you can give to a patient than to do an oral cancer screening. It is quite straightforward and doesn't take long. What does screening even mean? Screening is a process by which we identify indications of disease in people who are otherwise apparently disease-free. So why are we focusing on oral cancer? There's several reasons. Firstly, the rates of oral cancer have grown. While historically the majority of people were over the age of 40 at the time of discovery, it's now occurring more frequently in younger people. In fact, it's this younger demographic that is growing rapidly. Secondly, it's also now confirmed that the human papillomavirus, particularly HPV-16, which is sexually transmitted between partners, is conclusively implicated in the increasing incidence of oral cancer in young, non-smoking patients. Thirdly, historically the death rate associated with this cancer is particularly high, not because it's hard to diagnose, but due to the cancer being routinely discovered late in its development. So let's look at why dentists need to do this. Firstly, it only takes about a minute. Secondly, dentists are the only ones who can do it. They're the only ones who know what normal is in the mouth and conversely what's not normal. If oral cancer is found late, it has a high mortality rate. If it's found early, it has a very low mortality rate. Again, a very good reason to be doing it routinely. The last reason is that it adds value to a patient and gives them a very good reason why they need to return regularly for their active maintenance visits. Some facts about oral cancer. In most of the world this year, there will be more oral cancers diagnosed and with a higher mortality rate than cervical cancers. Oral cancer will kill as many people as melanoma, and oral cancer is more common than leukemia. So why don't dentists do it? We usually hear one of the following reasons. Firstly, I don't know how to do it. If that's your reason, learn to do it. It's part of your job description. You need to learn. You need to know. Your patients need your help. What if I miss something? I'll be responsible if I tell the patients I'm screening for it and I don't see it. Well, in the eyes of the law, you are responsible. So might as well do it and do as well as you can, because no matter what, you are the one whose job it is. Thirdly, some dentists say they are concerned that they may scare their patients if they tell them they're doing oral cancer screening. To some extent, this is exactly what you need to do. Ethically, you're required to make patients aware of the harmful nature of existing conditions or potential conditions in their mouth so they can make informed choices about treatment. Patients have pap smears, mammograms and prostate checks because they're scared of the consequences of not doing so. We need them to understand how scary oral cancer can be. And we need them to understand how coming to the dentist every 6 months for an oral cancer screening gives them the best protection from this devastating disease. It doesn't hurt that this can become a critical motivator for them to pre-book for and keep their active maintenance appointments. Talking about motivation, nothing is more effective when deepening awareness and concern about oral cancer than telling a story. The story I used to tell when I was a dentist, still practicing, was one about a friend of the family. This happens to be a true story. She was 25 years old, fit, strong and healthy, and just married. She didn't go to the dentist for about 18 months, and when she returned to the dentist, she complained of a little pimple on the side of her tongue. The dentist looked at it, referred her to a specialist who diagnosed oral cancer. She had to have surgery. She had to have about 80% of her tongue removed and her glands under her neck. She had to relearn to talk. She had to relearn to eat. Unfortunately, about 18 months subsequently, she died a very painful, uncomfortable death. I was watching this from the distance, and I made a promise to myself that no patient of mine was going to go through that if I had anything I could do with it. I promised to do an oral cancer screening on all my patients. We're now going to take a look at an example of an oral cancer screening. This is not about teaching you the details of how to do the screening, but more to do with the communication around the oral cancer screening. You will notice me calling out the areas of the mouth, face and neck to the DA, but sometimes some dentists prefer that the DA calls out the areas to the dentist. Who calls out the areas being screened is not critical, whether it's the dentist or the DA. What is critical is that the patient knows they've had an oral cancer screening and is motivated to pre-book to have this done again in 6 months' time. So let's start. We start by checking your face and neck. Neck's fine, I'm just feeling your glands, your lips, face is fine. Let's have a look inside your lips. Buccal mucosa inside the cheek, that's fine. That's fine, I'll get my mirror. Wide. Hard palate's fine. Soft palate. Say ah.
Ah.
Thank you very much. Oropharynx is fine. Underneath the tongue. So let's get the piece of gauze. Put your tongue out, please. And we'll put my finger there underneath the tongue. And on that side. And that's fine. As far as the oral cancer screening, you're okay.